Hi, my name's Matt Kliethermes, and I'm the training director at Children's Advocacy Services of Greater St. Louis and a clinical professor in the Department of Psychological Sciences at the University of Missouri St. Louis. I am also part of our NCTSN Category 2 project called Project Assist, which is intended to increase child serving professionals' access to competent trauma informed trainers, improve training skills and resources for trainers, and support and sustain trainers to meet systemic demands for trauma informed training. So, I'm here to talk about implementation, but really, we need to understand that implementation is just another word for change. When we are working to implement a trauma informed practice, we're just changing behavior from not doing the practice to doing the practice. Unfortunately, we all know that change can be hard, and implementation of a trauma informed practice is no exception. In our implementation work in St. Louis, we have looked a long time for ways to help agencies better understand why change is difficult and to make the change process more successful. With implementing or training people and implementing different evidence-based treatments like TFCBT, integrative treatment for complex trauma, we have just constantly seen that trying to make the switch to some of those behaviors that is needed to implement one of those evidence-based treatments is difficult. And so, in looking for research resources to help us help other people with that change, we discovered a book that we fell in love with. It's called Switch: How to Change Things When Change is Hard by Chip and Dan Heath. In the book, they note that for things to change, somebody somewhere has to start acting differently. Now, that sounds really simple in theory, but as we've seen, we all have an emotional side, which in the book they refer to as the elephant, and a rational side, which they refer to as the rider. For change to occur, you have to get both of them invested in that change. You have to reach both of them. Further, you have to remove obstacles to their success, which in the book they refer to as clearing the path. Therefore, there's really three things you have to do in order to really make change more likely to occur. One, you have to give the writer direction. And we can do that by finding out what's already working. Maybe there are bright spots. There are already individuals in the agency that are making the change. And once we find that, we want to figure out how they're doing it and copy it as much as we can. We really need to script the critical moves that need to happen in order for that change to occur. It can't be scripting every single little tiny move, but the big critical ones really need to be laid out clearly so people know what they have to do. And definitely, we want to make sure that we are clearly pointing to the ultimate destination. Where are we trying to get to, and how are we getting there? So, some examples of directing the writer that we've kind of implemented in our own agency. We've done things like, early on, it may be difficult for some therapists to find clients. And so we focused on therapists that have already found multiple clients and really looked at what are they doing in order to make that happen within that agency. We've done things like provide step-by-step scoring sheets for assessment measures to really script out the critical moves there and make it as easy as possible for them to complete. And in terms of like pointing to a destination, it can be things like all kids will receive a trauma focused assessment. So just making it very clear that this is our ultimate goal and these are the ways we're going to get there. When we think about motivating the elephant, this is the emotional side. And this is really important because if you think about a fight between the elephant and the rider, an elephant's usually going to win. So we really need to get that emotional side on board. So this can be really just about making people feel something. So, there is this emotional charge to what we are trying to accomplish. And many of you may have seen, like, they will talk about emotion is energy in motion. And that's really what we're trying to make happen. Other things that we can do is overly complicated, large changes can be really kind of frightening. And frightened elephants don't really work very well. So breaking that change into smaller, less scary parts can be really important. And finally, really wanting to instill just a growth mindset into the agency that we are all about making ourselves better, more accountable, more efficient, more productive. So examples of this in terms of like finding emotion, within our work with child trauma, we really have access to a pretty big heartstring that we can pull, which is this is about treating or serving children that have had trauma happen to them. So we can really emphasize that. In terms of breaking the change into smaller parts, if we're thinking about an evidence based treatment like TFCBT, maybe we really focus on breaking it down into the individual components rather than overwhelming people with thinking about the whole model all at once. Another thing, much of our training that we do is state funded. So we also highlight that we want to be good stewards of state funding and make sure that we are actually utilizing this intervention or practice that we are training them in so that that money that's been invested into this is being put to good use. Then finally, the third thing that we need to do to help facilitate change is shape the path. And really, what this boils down to is sometimes, in order to change the behavior, you have to change the situation around the behavior or the environment around the behavior. So, are there things that are happening that are making it difficult to do this? One that we run into a lot in TFCBT training is that they don't necessarily have people that can watch children in the waiting room while the clinician is working with the caregiver. So that becomes a potential barrier, and finding ways to address that could help shape the path to make the behavior of TFCBT easier to implement. With shaping the path, we always want to start to build habits because basically, when a behavior becomes habitual, it doesn't wear us out or wear out the rider the same way that new behaviors do. So, the more we can make something a habitual pattern, the easier it's going to be to sustain that. And then finally, we want to rally the herd. And really, what this boils down to is sort of the idea of peer pressure or that behavior is contagious. If we are surrounding people that are struggling with change with people that are really moving forward well with that change, that behavior is likely to pass on to everyone. So some examples of shaping the path, in our trainings we do for evidence-based treatments, we often include trauma-focused assessment measures in the budget request. So that's something we can provide directly to the agencies to minimize, their reluctance to go out and do that. We also usually require monthly data submissions about the work they're doing with whatever the practice is, so that they get into the habit of thinking about that and thinking about implementation on a regular basis. So these are just some ways that we've used these concepts of directing the rider, motivating the elephant, and shaping the path in our work that we do with implementation. Another thing that I want to highlight is we also teach these concepts to senior leaders and supervisors within that agency so they can start to implement these concepts in the work that they're trying to do with their teams as well. And we have found that these three concepts are very easily accessible by professionals out in the field and have really helped them come up with good ways to try to correct challenging change situations that they're running into. So both for yourself as someone who's trying to support implementation or as an agency that's trying to implement something, I would definitely recommend both that book and then this basic concept. So hopefully you find this helpful. I know we have in the work that we've done.